Hello everyone, welcome to sqadia.com. I am Dr. Shafaq Jalil and today we will talk about disorders of neurohypophysis. Neurohypophysis or posterior pituitary is the posterior lobe of pituitary gland which is part of the endocrine system. It is not glandular as the anterior pituitary. It is basically made up of axonal projections from the hypothalamus, and it is located in the sella turcica of the sphenoid bone. There is a small depression in the sphenoid bone where lies the pituitary gland, and this is basically the posterior part of the pituitary gland. There are mainly two secretions of neurohypophysis. One is the AVP, also known as antidiuretic hormone, and the other one is oxytocin. AVP acts on the distal tubules of kidney and in order to conserve the water, whereas oxytocin is basically involved in postpartum milk let down in response to suckling. Whenever there is deficiency of AVP, it leads to the production of a syndrome known as diabetes insipidus, which is characterized by the production of excessively large amounts of dilute urine. Whereas in case of the excess production of AVP, there happens a syndrome in the body that is known as the syndrome of inappropriate ADH secretion, in which there is hyponatremia if the water intake is not reduced in parallel to the urine output. Now, in this presentation, we will discuss about the AVP and oxytocin. We will talk about their physiology, and then we will discuss all these diseases a bit in detail. Let me give you an overview of all the sections which we are going to discuss. In the first section, we will talk about deficiencies in secretions and function. We will see what are the disorders of neurohypophysis, what is AVP and oxytocin, where are they coming from, what is their function, and finally we will see what is the deficiency in AVP secretion and function. In the second section, we will talk about diabetes insipidus. As I have already told you, in case of deficient production of AVP, a syndrome occurs in the body which is known as the diabetes insipidus. It is characterized by the production of excessively large volumes of dilute urine. We will talk about the etiology of diabetes insipidus, what is the pathophysiology behind the syndrome, and what are the differential diagnoses and how we can treat this syndrome. And in the third section, we will specifically talk about the diagnosis, the differential diagnosis, and treatment of diabetes insipidus. So this is our today's lecture. I hope you are excited to learn about this topic. Keep watching sqadia.com.